Hi Luna, I'm Dr. B. How are you today?
Hi, Dr. B. Great to see you again.
Good to see you. So we're here for a bit of a skin and scalp check.
That's right.
So what that entails is me looking through your hair, making sure the scalp is nice and healthy, the hair is nice and healthy, and then also looking at your face with a bit of face mapping, just sort of break it up by zone, see what type of skin you have, and look closely at it, okay? Alright, so let's start in the hair. So I want to make sure I'm not going to hurt you at all. Is there any pain in the head when I touch you?
No.
Just going to look with my eyes here for anything jumps right out to me. Okay. Hair is very thick, so we definitely want to make sure we're doing a thorough check of it and of the scalp. If there's any discomfort at any time, just let me know. Where do you normally part your hair?
Down the middle.
Just down like this. Okay. Paying particular attention to that. Sometimes that's where we get the most sun exposure. I'm going to look closer now. I'm just going to get a light and separate the hair. Any itchiness on the scalp?
No.
About any burning?
No.
And what kind of products do you use in the hair? Shampoo and conditioner?
Yes.
And how often are you washing the hair?
Every other day.
And any hairsprays or additional moisturizing products?
I do use argan oil.
Okay. And how often is that? Just when you wash?
Yes.
Okay. Looks really healthy at the roots here. Do you ever use heat products on your hair? Straightening iron or blow dryer?
Usually I use a straightener, yes.
Okay. I do see just a little bit of breakage. Nothing serious, just a little bit of breakage, but we can moisturize, do a little bit of a hair moisturizing treatment at the end here. Have you move back to the center now? Thank you. And tilt your head for me. Anything caught underneath there?
No, but
Okay. You always had thick hair like this?
yes,
Yeah, it's really wonderful.
runs in the family.
That's great. This doesn't seem to be any balding or hair loss whatsoever. Obviously, a normal amount of hair loss is, several strands a day. But if you're experiencing like large clumps ever, or if sections are thinning out, just let us know. Just checking the bottom of the neck here as well. Brush that hair out for you, but everything looks great. I didn't see any issues with the scalp, no redness, no flaking, no freckles or anything hidden underneath there. I'm just going to run this through your hair, just looking for any nits or lice I might have missed. Looks great. Since your hair is so thick, do you have any issues with tangling or knots?
Oh yeah, it's very hard to untangle it after I wash it.
Oh, okay. And that might be also some of the reason for that breakage I'm seeing, is that when you try and brush it out and it's wet, it cause some breakage for sure. Wet's better than dry though. Any pain when I'm pulling here on the hair?
No.
Just working out some of those knots. Alright, let's do a little bit of a hair and scalp treatment for you. So just going to involve me spraying some things into your hair, and then I'll be working them with my hands, okay?
Okay.
give you a little head massage while I work it in here. Pouring on the scalp here, just getting the blood flow started. That product should start working. Does that feel okay? Anything poking you out of place?
No, everything feels great.
So I want to take a look at your face now. And with face mapping, what we do is we break the analysis down into sections. So we've got the chin section here, the cheeks section here, the nose, the forehead. And we do that because different parts of the face produce different levels of oil, or dryness in some cases maybe. And so we want to treat them individually. We don't want to treat it as a whole. As you may know, the skin on the forehead is a little bit tougher, a little bit more taut across the face, versus the cheeks are much more plump, oftentimes prone to redness, rosacea, things like that, while the nose is often prone to blackheads. The pores are a little bigger on the nose than the rest of the face, so it just makes sense for us to look at it in sections. So let's start out with the forehead here. And what I'm looking for is just the makeup and the complexion of the skin. And so we've got fine pores up here on the forehead. Looks like no breakouts, maybe one little. Is this something you may have picked at there, or?
Oh yeah, I think so.
Yeah. Okay. See just a teeny bit of scarring, and that can just be from acne or just age and the skin changing. But your skin looks really clear and healthy. Beautiful skin, nice and moisturized. Just a couple little freckles here and there. I think you have freckles along the face though, so that's typical for you, right?
Yeah.
Okay. Just keep your eyes closed. I'm going to move down. Just look at the eyebrows, and the hair is thick and they look pretty symmetrical. Let me just double check that. If we see any unusual hair growth in this section, we just like to track that. Okay. Those are perfectly symmetrical. I'm just going to measure from the eyebrow to the ear. Okay. And just from the midline of the nose to the start of the brow. And those look great. Measure across your forehead here. a nice symmetrical forehead for the size of your face. Proportional wise, it's really good. It is less than half the face, which is great. That's what we're looking for. The length of the brow, about 9 centimeters, and versus 17 for the half face. Again, on this side, same thing. Perfect. Just going to check the arc of the brow as well. Okay. And it looks like both have the same arc dimensions, and that's perfect as well. So let's take a look at those. I'm just going to look at everything first, and then we'll do the treatment together. So moving down now to the cheeks areas. And the pores are small, a little more freckling there. Do you wear sunscreen daily?
Not daily.
Okay. Might want to try incorporating a sunscreen into your routine in the morning, or having perhaps a tinted sunscreen as your makeup if you do wear makeup.
Yeah, I should.
Just want to protect that skin. So there definitely is some more freckles there, but nice and clear. Pores are small. A little bit of oil on the cheeks. That's very normal, very typical, especially because I'm shining a bright light on you. Any tenderness on this part of your face?
No.
Okay. Just going to take some of these measurements again. I'm looking for the symmetry, so about from the nair to the base of the ear here. And that's perfect. So no swelling that I've noted there. And I'm just going to keep your eyes closed. I'm going to gently get from the corner of the eye down to the base of the face. There's just a touch of asymmetry there. It looks like there's just a little bit longer on the right side than the left side. That's totally normal as well. But I think nothing to be concerned about. Take just a couple of measurements to confirm that. About a centimeter difference, or half a centimeter even, nothing noticeable. And that is perfectly symmetrical. Moving on to the nose. So I am seeing just a few blackheads in the nose area. See a little bit of oil there. You do have a beauty mark, it looks like. Does that bother you at all?
No.
Okay. Just a typical amount for the nose, nothing unusual or abnormal. Just measure from nair to nair. Symmetrical. Just going to make sure that it comes up the same on both sides. Very good. And lastly, just looking at your chin. And the chin is beautifully clear and not too oily. Maybe a little bit of dryness right at the bottom, but honestly the chin looks really nice. Just feeling for plumpness here. Good moisture distribution, good skin elasticity. Sorry. And good symmetry as well. The chin's looking like it's in great shape. So let's go ahead and address some of that oil production here in the top portion of the face. That's what I want to pay most attention to. So I've got a couple different bulbs here. One is heating and one is cooling, and I want to do them both because I want to really open up and wake up the pores and yet also relax them at the same time. Okay, so I'm just going to roll these over the face. Let's go ahead and remove some of that oil. Are you comfortable with me doing one or two extractions on the nose?
Yes.
So I'm just going to do some basic extractions. I'll be gentle though. Sometimes this oil can just build up a little and just takes a little bit of pressure to release it. I really don't have too much, I think. You'd just benefit from a little bit of an abrasive scrub or something in the shower. Just right on the nose area there. It's not too much is coming out. Just check anywhere else in the face. I want to calm down your skin. I'm just going to put a little bit of oil and we'll wash this off when you're done here. I'm just going to give you a little bit of massaging of the face, okay? Just let me know if anything's uncomfortable. Just doing a little bit of lifting with this as well. I think that's your face mapping done for today, and your scalp check. Everything looks really great, really healthy. Again, just maybe consider using a little bit of an abrasive scrub for the nose and the inner cheeks area for some of that oil and buildup. But otherwise, I think you look great, and I don't need to see you back for at least another 6 months.
Thank you.
Thank you.